Mm. So I am going to start. Hello to you all, and I am absolutely delighted to be opening up our leadership stream at our conference today. If you don't know who I am Sue Jones, Director of Social Care for the Institute. And what I 100% believe is that care should be seen as a profession, because we all know it is a highly skilled role that people aspire to work in and be part of. And certainly as part of my role, I have the absolute privilege of running in-person leadership training events across the country, which is where I met this lovely lady who I will introduce you to in a moment. So this session is an open discussion where I will be posing some questions, and I cannot think of anyone better than our speaker today that can tell their personal story and their journey from career carer to care manager, particularly as she has come from another sector. So enough from me, and over to you, Sabrina. Would you like to introduce yourself, the company you work for, your role, and how long you've been there?
Oh, thank you. Thank you for having me here today. It's really nice to be here. So yeah, my name's Sabrina Bennett. I work for Premier Community, which is a domiciliary care agency in the Nottinghamshire area. I have worked for Premier Community now for 4.5 years. I joined during COVID, was the time that I joined Premier Community. Previous to that, I'd spent 17 years working in hospitality. And if I'm really honest, I didn't know much about health and social care, I'm ashamed to say. I started in hospitality when I was 14. I had worked in hospitality all that time. I'd worked my way right up to a trainee area manager for a company called the Restaurant Group, which most people hear of it from things like Frankie and Benny's, Chiquitos, places like that. And obviously, you know, COVID hit, and that took a bashing on the hospitality industry. And I find myself at home with 2 children, not really knowing what to do. So I had a lot of family members that actually worked in health and social care in various different ways. And they sort of said to me, you know, rather than sitting at home, why don't you sort of see if you can get into volunteer work and things like that. So I thought, yeah, I've got to do something. Didn't know how long I was going to be off work for. And I came across, the first company I actually came across was Premier Community when I looked online. I had a bit of the read of their ethos. And if I'm really honest with you, I didn't have a clue what it entailed. And that is me being absolutely honest. I had a good read and I thought, oh, this sounds, lovely. I just wanted to kind of give something back within where I was working. In my local area. The kids were obviously off school, so I still need to be flexible around them. My husband was working full time as a police officer, so it had to be a flexible job. So came in for my interview. Of course, there was nothing. It was all online. There was no training in house. It was all done online. Was successful for the job. My first shift was just mind blowing, really. So I went out with a wonderful carer who'd been working for the company for a long, long time. She was fabulous. And by the end of that shift, I met some of the most wonderful people who will always stick in my brain now. And she was wonderful. And I just thought, you know what? In all these years that I've been working in hospitality, I don't think I've ever seen a sense of achievement like, in the same way. And I just fell in love with the job. And I did it full time all throughout COVID. And then beyond that as well. And loved it, learned so much, changed a lot as a person because, it was just something so new. It was so new. And to be able to go home every day, yeah, I mean, I sound like it's a bed of roses. There were some really tough days, don't get me wrong. But I can honestly say that the job got me through COVID and actually managing through, a difficult time. And then when obviously, restrictions were lifted and things like that, then, the opportunity was to go back to hospitality or not. And I just made the decision not to do so and continue doing and start again. Effectively, it was like starting my career again. I'd worked for 17 years to get to where I wanted to be, i.e. an area manager at the time. And I just thought, I couldn't envisage leaving these people. And so I started again. I continued as a carer up until I joined the office team around 3 years ago, I think it was. I was approached about coming into the office and being a care coordinator.
Okay, so that's how you could actually see that pathway come in front of you and those opportunities opening up.
Yeah, so they contacted me and sort of said, we've got some openings coming up. Obviously, not just myself, there was some, other carers as well. And they sort of said, there's this promotion coming up, you're interested. So I did the interview, came into the office, and it was hard, actually. So if I'm honest, the first few months I kept thinking, I don't know if I've made the right decision here. It's tough. I'd missed the people that I was working out in the field. I missed being quite hands-on. But do you know what? It was brilliant. It taught me a totally different side of the job. It gave me a full appreciation for how hard it was, because when you're out in the field, you don't see it the same. So it gave me a really good opportunity to see it from all angles. And actually, I realised that you're still part of the caring network for these service users and these carers. So I loved it. I loved it after I'd kind of got my head around it. I was Rotary and I met some amazing carers, but on a much wider scale rather than just my team that I was working with in the area I lived. It was amazing to be back in a position where you were sort of supporting and helping people. And I actually there was 3 carers that I supported to actually also get the confidence and train up to come in the office as care coordinator as well, which was great. So I interviewed them when they started and then sort of helped them get into the same path as I did. And then about 2 years ago, so it would have been 2 years in June, the opportunity for a registered manager came up, and again it was one of them. I thought, I feel like I'd love to give this a go. I'm going to give it I'm going to have an interview and I'm going to do my best, and that's all I can do. And I was successful, and I absolutely love my job. It's the best decision in my career I could have possibly made. I've learned so much, and I am in awe of this. I mean, it's just a brilliant sector to be part of. Very tough. I make it sound like it's a very tough job.
But I would be interested to know, how does it compare, in terms of toughness from hospitality to, what's the comparisons there?
It's a lot tougher, I think, emotionally, if I'm honest. And when I say I've changed as a person, I have changed as a person. I worked in a multi-billion-pound company that was, it was very corporate, let's say. And I learned a lot. I mean, don't get me wrong, I learned a lot. A lot of my skills, my transferable skills I brought over have come from hospitality. So, that goes down to complaint handling, conflict resolution, offering a service, making sure that people are, they have the right to have a service, whether it's in hospitality, whether it's in social care, dealing with people, knowing how to deal with people, managing people, all that sort of stuff. Are transferable skills. It's the same whether or not it's hospitality or this industry. But I think for me, working in obviously social care, is that there's a lot more emotion there. There's a lot more emotionally involved, and it's hard. I think as a registered manager, it is very tough. It's very, very tough. You've got, there's a lot of factors. There's a lot, there's, as we know, there's underfunding. There's, there's sometimes I find myself, I can get quite emotionally involved. It's very hard sometimes, you see somebody, especially, somebody that you might have worked with for a long, long time. And, it's hard because of, sometimes the restraints that are around you and things like that. So emotionally, it's harder, but yeah, it's a totally different job, but this is so rewarding, and that's probably the difference. And I always sort of say to people, my joke is that I couldn't even imagine going back to hospitality, and I don't feel I would have got the same job satisfaction from serving somebody a spaghetti carbonara as what I do every day now. And that was the big thing for me. I can go home and sit, and yes, it might be sometimes I have to sit and take a breath and go, today was really tough, but actually I always feel like I've achieved something, and I've made some sort of difference to somebody, whether that is a carer, whether that is one of my managers that work in the office, or whether that is a service user or whoever. There is a massive sense of job satisfaction, which is what keeps my focus.
Absolutely. And this is I know that recruiting people is really hard into social care, but when people hear a story like yours and think, you know what, that sounds something that I could really, it gives me a purpose. It gives me that sense of satisfaction. And that's what you can't see that from a job description, can you? You've got to really shout about that whole experience. And I think that's really key. You've got to be able to do that when you are trying to attract people, not just from hospitality, but any sort of service industry. And I'm just hearing what you're saying there. It's really your superpower, isn't it? Because you've got all the really soft skills, communication skills, that sort of thing that you have learned from another area that you have really transferred into care.
Yeah. Oh, absolutely. Listen, I'm a huge advocate for care. There's 3 managers that actually I used to work with in hospitality that now work for Premier Community. Wow. Because I am a huge advocate, and I've got quite a large network of people that I speak to within hospitality. And I think, I've sort of said to them, yes, if I'm honest, if COVID hadn't happened, would I still be working in hospitality? Yeah, probably. I probably would have done. But that was due to the fact of I'd never really tried anything else. But I believe everything happens for a reason. And, I was very privileged, I suppose, during a really tough time, that, it actually put me in a much better place, in a career-wise. And I think it was just, I think I just stuck with hospitality because it was just what I was comfortable with, and it's what I'd always done, and I'd not done anything else really. But yeah, I mean, I'm a huge advocate for anybody joining social care. It is a fantastic, it's great to be part of. Yes, of course, there is lots that we could sit, I'm sure, all day and discuss the difficulties that are involved with social care and things like that across the country. But from somebody that does the job that I do, sometimes you have to just part that and do the best that you can do, and take away the satisfaction you can get from it, as much as it is a really tough job. There's no there's no point me sat here saying it's not. It's really tough job to do.
And I'm really, because I know that there are a number of registered managers leaving at the moment because of the fact that it is tough and it is emotional. What advice would you give to somebody who feels like that at the moment?
I think, to be honest, and I've been guilty of it myself. I think because it is such an intense job and it is a difficult job at times, it can be so easy to get embroiled in it and get yourself sort of lost, and you take on so much because you're responsible for so many things and so many people. For me, I think one of my biggest advice to anybody that would be struggling with this job would be network. The people I work with, the registered managers, I mean, in the company I work for, there's 3 other registered managers. They are absolutely pivotal to my success, and I hope they would say the same, as well. We work together. If something comes up, we discuss it. We say, look, I've got this situation. What would you do? Or if you've had a bad day, I'll go to them. They'll come to me. We'll have a conversation. We'll speak to them, and that is massive. If you are that sort of person, for me, I need to be able to have that network. But not only that, I network with lots of other people as well. So I hope I've got really good relationships with the social workers in my local area, right? Occupational therapists, district nurses, all these people that that you work with every day, and are so important to build a relationship with. It's amazing how much support they can give. And actually, you tend to find, or I've tended to find, that your frustrations are their frustrations, and they are still people, and they need to be, so I work really closely with them. I'm part of various different networks as well within, Derbyshire County Council, which is the local authority I work for. And I'm part of a network with them as well. So we have meetings there. I speak to registered managers who work for other companies and other organisations, and I've built relationships up there. And that's, for me, what I find really, really useful. And of course, the last thing is to take time, and it's okay to say I'm not available for the next 2 hours, which is something I found really tough. And I don't even mind admitting that I found that really tough at first, of actually saying, you know what, I need a minute, whether I need a minute for myself, just to have a minute, and I'm going to go and take the dog a walk for an hour just to clear my mind, or whether that is, you know what, I've got something that's really important and I can't have any distractions because it's somebody's medication, or it's somebody's moving and handling plan, or whatever, or I've actually just had a really tough meeting that actually I need some time to to say, I need space. And it's about being able to say that without feeling, I suppose, guilty, because that's how I used to feel. All these people need me. I need to be available all the time. And, sometimes you have to say, no, actually, I need this time.
Absolutely. And what I love about what you've said there, obviously, yes, definitely take time, but it is the influence of the people that you network with that can have the biggest impact. Because if you surround yourself with and have that element of control, we do the circle of control and the circle of influence. It's having, if you feel in control of that gives you much more reassurance, doesn't it? An ability to think, you know what, I've got this, rather than feeling completely out of control.
I think by having a network, Sue, as well, is I'm now in a position where if something comes up, I always feel I've got somebody to go to. And then you've got your certain people that you just think, I know who's going to have the answer to this, or I know who's going to give me the best advice for that. And that is so,
wow.
It is, yeah. And that is definitely what is the best coping mechanism for me, is just reaching out and having the confidence to reach out and say, do you know what? I don't know what I'm doing here. I need some advice. I need some support, and not being afraid to say that, because, we work with people. There's going to be situations you could be. I mean, one of the registered managers I work with has been doing this job for 40 years. And there is still times that she comes and says,
I don't know.
I don't know what I'm doing. I'm working with, people, whether that is carers, whether that is managers, whether that's service users or whatever, we all need that. Times change times have changed, and we need that support. So it's so important.
Every day is a learning day, no matter what, isn't it?
In this job, definitely.
Definitely. I think certainly in my job, I learn something new every day, without a doubt.
Yeah.
I'm just checking to see if there is any questions in the chat before, but no, that's absolutely fine. Please do, if anybody would like to ask Sabrina a question, please do put your hands up or shout out, because we've got a few minutes before the end of the session. But, for me, what I've heard is the fact, that's the one takeaway that I'm going to certainly take away from, is the fact that you are surrounding yourself with these positive people, but also they act as a resource for you. And when I think sometimes when I go onto the social media platforms and, look at the Facebook groups, and I can see there's a lot of negativity, and I feel really sad about that, because if that's all you're hearing is that negativity and you don't know where to go, then there is no choice for you, is there, other than to leave? So how can you surround yourself with these positive people, and the additional resource, I think, would massively help people.
Yeah, and I mean, I suppose I'm lucky. I work for a really, I'm a massive advocate of the company I work for, of course.
Yes.
But they've been really good. They have adapted to my own learning. They've sort of said to me, what pathway do you want? What do you need from us? What can we do to help and support? Which has been really good. And then they've tried to find, various different resources. I've done my level 5. That was amazing. I learned a lot from that. But a lot with this job, I think you learn on, you need to learn it on the job, and you need to spend some time doing your own research and learning the way that is right for you.
Okay, we've just had a really good question in the chat.
Oh gosh, right.
This is from Liam. Any suggestions as to how to encourage registered managers to network with others? Because it is a skill, isn't it?
It is a skill, and I think I talk about networking. I'm a very sociable person. That's what I do. But I also understand that some people aren't. They're not as sociable as I am. I think it's sometimes about trying to find the person or the right person for you. If you've got a personality where you might find it really difficult to kind of go out there and network and put yourself out there, which I've got quite a few managers like that. I think sometimes you've got to try and find somebody, whether that is going to further out network meetings and think, do you know what, that person I think would be the right, person. It's trying to understand their style of who is going to work with them, because somebody might find me quite eccentric. So, there's no point in saying, go and network with Sabrina, because they might think, no, she's far too much for me. Whereas there's others that, of course, are a lot, learn in a different way and work in a different way. And I think you've just got to try and help them find somebody that would work well for them.
Yeah, absolutely. And I just wonder whether we actually do a session on how to network with peers. I think that might be a really good power hour session that we can do as part of people's development. I mean, I know you are naturally an extrovert. I'm an introvert. It's not something that I do go out and do it, but it just takes a little bit more of an effort to do that. So absolutely fantastic advice. Thank you so much, and well done for doing this today. That was a big ask, and I am so glad you came along. You have been amazing.
It was a pleasure.
Thank you.
It was a pleasure. And if I can inspire anybody else to do this job, then I would, because we need managers. We need registered managers.
Yeah, we do. 100%. We do need them. And as I say, this is a absolutely amazing career, and we want people to get involved and join that whole career pathway, which we'll be talking about a little bit later on.